Good evening, Dr. Hughes.
Good evening, Jim. How are you?
Very well. Thank you very much for coming on to the programme tonight. First of all, can we deal with the people who are still sceptical about the vaccine? What sort of reasons are you hearing from people who are reluctant or sceptical at this point in time?
So very timely today that you've called me, because I did a webinar today with some with people in Camden, just having some Q&As, and there are lots of reasons, really. People who, a lot of women who are pregnant, who are worried about the safety of vaccines in pregnancy. Yeah. People are concerned about what might be in it. They, on religious grounds, we've done quite a lot of work with faith leaders because people have been concerned about potential blood products or human or animal products, and categorically, I will tell everybody that there's no such product in the vaccine. People have heard of side effects, and they're scared because they've heard that somebody they know, or a colleague or a friend, has felt unwell after a dose, and they're worried about going forward. And some people are just generally worried. There's a lot of sort of misinformation out there, and it's understandable, really.
Let's deal with the ingredients question then. So you're saying categorically there are no ingredients in either the AstraZeneca vaccine or the Pfizer vaccine that would compromise anybody's religious or ethical beliefs?
Absolutely right. Yeah, they're both synthetic vaccines. They are chemically produced in a lab, and they are both based on the spike protein of the coronavirus. So scientists have, as I say, they've cracked the code like a famous Dan Brown novel. So what they've been able to do is replicate that in a laboratory, but there is nothing of human origin, of animal origin, of blood products, nothing like that whatsoever. So people can be very confident that by taking this vaccine, it will not compromise their religious or cultural beliefs.
One of the questions posed to the Minister, Nadhim Zahawi, yesterday with regard to the amount of misinformation out there is that there's a lot of articles being spread around on social media, WhatsApp chat groups as well, which are fueling people or undermining, I should say, people's confidence in the vaccine. What are the sort of threads of those kinds of bits of misinformation, and how far wide of the mark are they?
So they're varying, really, and I guess it depends. It's a bit like Chinese whispers. Somebody starts a rumor and they spread really quite rapidly. What I do is we've been running a vaccine hub for seven months now, and we've been really, really keen that we work with our communities. So we talk about things for women around things like fertility, that there's no evidence that the vaccine either affects fertility or affects pregnancy or breastfeeding. There have been some reports where it might change the cycle of a woman, maybe for one cycle, but there's nothing at all that is long-lived. Everything is short-term. And we've vaccinated, as a lot of my colleagues have, thousands and thousands of people through our vaccination centres now. And we can honestly say that the vast majority of people feel completely well. So some people might have a mild side effect, feel a bit faint after a vaccine, have a headache, feel a bit feverish, but they're all mild side effects which people recover from.
One of the questions that I get regularly from callers who are confused or reluctant or worried about the vaccine is, how do we honestly know that? Because we have only had this vaccine in our midst now for 200 days in terms of the full cycle of the development of a vaccine, and its implementation and usage is normally something that happens over a period of at least a decade, if not more. And this whole system has been truncated down to a very, very, or expedited in a very, very speedy way. So how do we honestly know that there aren't any long-term effects from this that have yet to be identified?
And that's a really common question, and very understandable. I mean, we're in a pandemic, so vaccine production is something that happens year on year. You look at something like the flu vaccine, for example. Every single year, the flu vaccine is a race against time because we know that a virus mutates. So literally every year, when we offer people a flu vaccine, it's different from the one the year before. But there are rigorous trials and tests done, and we have European regulators. We've got the UK regulator, which is the MHRA. They do rigorous testing, and the MHRA has been around for years now. They approve every single drug that comes on the market. So everything is a risk versus benefit ratio. We're in a race against an awful disease right now, and now we know that they were potentially rolled out quite quickly in some people's eyes, but not without testing. But we have given them to millions and millions of people across the world now. So we now have a lot of data about these vaccines, and they are very safe. They are very effective. Yes, we know they have side effects, and there are some serious side effects, but that's the same with any drug. But if you look at the benefits versus the risks of the drug, for the vast majority of us across the world, these are safe and effective vaccines.
I've got a question from a caller who didn't want to come on air, and as I said, that's completely fine and understandable. 0800 731 2000 is the number if you do want to ask a question. And the question is, why don't we hear more about the negative side of what could happen when people have the vaccine? You never hear that anywhere. I know we're trying to encourage people to come forward, but it makes me suspicious. I'd rather have all the facts.
Yeah, well, you can actually have all the facts. If you go to the MHRA website, which is a gov.uk website, the side effects are listed there. We report everything under something called a yellow card scheme, and that information is freely available. So that it is very, very open and transparent. And every time anybody reports any side effect, albeit a sore arm to me or a bit of bruising, anything, we report it through the yellow card scheme to the MHRA, and that data is widely available. You can ask for it, you can search for it, so there is full transparency on that.
And I have done that. I've looked at the yellow card scheme. I've read a lot of the information on there. It's quite stodgy to work your way through it because it's obviously written in quite medicalised language, which is understandable. It's the MHRA website. But at the same time, it did sort of perhaps increase my concerns about side effects. But as you say, what you then have to do is put that into the broad context of the numbers of people who've received the vaccine safely. And of course, the point of the vaccine, which is the negative aspects of COVID, which we know are deadly.
Absolutely. And so the obvious one, which has been coming up a lot, is the blood clots link with AstraZeneca. And it is an incredibly rare but devastating phenomenon. We know that for the people who've suffered with it. However, if you put that into context with the risk of blood clots with COVID and the number of people who've died with blood clots with COVID, it's far, far higher than with a vaccine. So, nothing is without risk. Everything we do in our daily lives carries a risk. And I guess for all of us, we have to weigh up, is this more beneficial to me? Is it more risky for me to take the vaccine, or is it more risky for me to get COVID with all the unknowns? And it's not just about dying. Remember, we've got a lot of people now living with the emerging condition, which is known as long COVID. And that doesn't discriminate. It really doesn't. And as a doctor, we're seeing more and more of that, I can tell you, in our clinical practice. And it's very difficult to manage. We're seeing young people who are literally struggling to climb stairs where they've been out running and exercising, and, they can't get back to their daily lives. And it's a devastating condition.
One of the other aspects that I suspect will be discussed at the summit tomorrow is that there may very well be a number of people who've yet to come forward and have their first or second doses who perhaps don't have the right documentation, don't have an NHS number, for example. Maybe it's just a language issue. They don't know they can come forward at this time. There are difficult pockets within our communities, particularly in a vibrant and multicultural city like London, where we're going to struggle to reach people. So how do we go about tackling that problem?
That is a real issue, but we are tackling that. There are lots of pop-ups around London which are being worked on with our communities, with our councils. We've run a fair few pop-ups for the homeless population and the unregistered population. Lots of mosques and community centres, vaccine buses, lots of initiatives around the country where you can just turn up and get a vaccine. So you don't need to have an NHS number. You don't need to be registered with a GP. you just turn up and you can get a vaccine. So all of those initiatives are going on, and we're using data to see where uptake is low, so that rather than people having to come to centres, we go out to them. And we've done quite a lot of work with our local communities around trying to find where people might turn up, so that we can do those pop-ups, and they've actually been quite successful.
How significant is the invincibility factor, and young people thinking, well, COVID doesn't affect me, I'm young, I'm healthy, I don't need the vaccine, and I don't want to take it? How big a issue is that?
Do you know, it's really interesting what we're seeing. So when we initially went down to the sort of 40s and 50s, we had a real drop-off in people turning up for a vaccine. And I think that coincided with some of the reports coming out about AstraZeneca. However, as we've moved down to the lower cohorts, under 30s, it's been overwhelming the demand for a vaccine. And the youngsters, so I work in a student population campus near University College London and University of London. The 18 to 25-year-olds are desperate for a vaccine, and it's really interesting because I think they're fed up. They want to go out, they want to travel, they want to enjoy life. So we're seeing a real sea change actually in what we thought might be a hesitant population, but they're not.
And are young people able to choose which vaccine they get? Because obviously, as you mentioned, there is concern amongst the younger population about the blood clot issue.
Yeah, well, we're not giving. We're only giving Pfizer to this group or Moderna.
Okay.
So they have a choice.
And what about information? I mean, prior to coming to actually receive the vaccine, where should we go just to get the very best quality information about the vaccine?
Really good question. So Public Health England have published lots of leaflets. If you just Google Public Health England COVID vaccine, you can get really good comprehensive information in various languages, and you can just download that from their website. And it's fantastic. It's really, really good. And they've updated those leaflets as the campaign has gone on. So that is a really good source of vaccine information. And also a lot of our websites, so our GP websites, we've got links to all of these sort of recognised information sources as well.
Just finishing on a positive, I mean, some of the statistics yesterday, 9 out of 10 people are confident to come forward and have the vaccine or have already had it. 60% of the adult population have now received both doses, which is astonishing considering we're only 200 days into this vaccine program. I mean, in terms of the success of the vaccination program, it really is the key to unlocking the door to getting us out of this pandemic, isn't it?
Absolutely. And the public have been fantastic, actually. It's been a real pleasure to be part of it. And you said it at the beginning, if people are worried, there's no such thing as a stupid question. And, you know, we're always here to help. Those of us that are involved in this campaign as health professionals, we're always happy to take questions and answer them. And remember, when you come forward for a vaccine, it's with your consent. We are never going to force anyone to have a vaccine if they are not ready to have that vaccine. But we are always here to answer your questions.
Good stuff. All right. Thank you very much indeed. Dr. Ammara Hughes there, GP and Clinical Director of Central Camden Primary Care Trust. Good luck with the rest of the programme. The summit takes place tomorrow.